The pandemic continues, and so does the work of the Caribbean Sign Language Center. Executive Officer Nicole Paul joins us to give us an update on the activities of the center. So we say thank you for joining us, Mrs. Paul. How are you at this point?
Thank you, Mr. Rosland, for having us here again on TTT. And how do we feel? We really feel wonderful. Perhaps a little tired, but surely happy to be here, happy to be helping Trinidad and Tobago inform its deaf population in this time of COVID-19.
So working in this time of COVID-19, what's a status update on some of the work that you're doing during this pandemic?
Okay, well, as you know, we have been working really hard, making sure that as the Minister of Health and the Ministry of Health and its various officials give all that information and updates about what's happening with COVID-19, you know that we are there. We are thankful that our Ministry of Health understands the importance of having deaf people able to get that vital communication. This is the sign for communication in real time. And we want to say actually thank you, because not everyone in our society understands the importance of sign language to deaf people. And that is why I am thankful to you, Mr. Rustin and TTT, for making it clear that we need to communicate more about helping our deaf citizens get the information in this time and other time.
Now, in terms of providing that, and I'm going to try it now, in terms of providing that communication, let me know if I was right or wrong, but you were providing communication services for the hotline. Is that still ongoing? This is the COVID-19 hotline.
Yes, we have been doing that valuable work, and I thank you for raising it, because deaf people were totally out. We had no way of getting anyone who was deaf to use a regular phone line, as you understand. So what we did, we said, okay, fine, understand, we can do this. We wrote to the Ministry of Social Development, and they were, it was wonderful because they responded. They said, okay, fine, let's get the UN involved. And the UN said, okay, we want to have this relay service provided for deaf people, and you guys will be just right to do that. And we worked, and we had our teams of relay interpreters, everyone with their tablets and their phones. And as the deaf person would call, we would go and we'd call the ministry's hotline, and we would get through many times. Sometimes there were even problems there, but the fact is that for the first time, this is great, first time, our deaf people were able to make contact and have their concerns about COVID-19 relieved through the service that was provided. And that continued until the 29th of August. So now it has in fact fallen, but we feel that it was important that it was there, that people were able to get some of the services that they needed as well from the Ministry of Social Development through that important work.
And how are you keeping your members safe? Because there's a great deal of work that is taking place. And even just over the past amount of time, there was interpreting for conferences, newscasts. I saw some members at political headquarters for the elections that recently passed. What kind of safety protocols have you put in place?
Okay, fine. I'm glad you raised that, because we have persons who work with us. I want to give you an example. This one interpreter, he's deaf, and for most of the time, he did not come to do any interpreting, even though he's very, very good at it, because he has what our Minister of Health describes as comorbidities. Right. He is, in fact, diabetic. So we have to be really careful. So what we do, we insist, we tell our interpreters, please, everywhere that you go, make sure the area is sanitized, make sure the area is clean, make sure you have your mask up. We gave masks to some of our interpreters. We need some more. But people generally follow the instructions. Mask up, wash hands a lot, This is time to wash hands, as you may think. Use your sanitizer. Make sure the area is clean, very, very clean, because that is very, very important. Because we want to do our jobs. We know the importance of making sure that Deaf Trinidad and Tobago is getting the information. But as I said, it's necessary to protect ourselves also. Yeah.
Now, with regard to the masks, I'm not going to try to go out too much out of my lane before I try to play charades with you and just kind of disrespect the entire thing. But in terms of those masks, I saw one of the members of the center have a mask that has almost like a window pane. Is that something that you all have put some work into or trying to source differently? Because it's been said that that is one of the things that can help people who are hearing impaired or deaf understand a little better. What is the status with that?
As you know, we work together with, in partnership with, the Trinidad and Tobago Association for the Hearing Impaired, right? TTHI. Now, I went there and I have a very good relationship with everyone there. And I was asked by their accountant, actually. She said, Nicole, we got these masks specially made for communication with deaf people. I need you please to try it out. I said, bring it, please. Let's try it out. And those masks have that window that you described so that your expression, which is extremely important to sign language without expression is dead. Right. So it has a window that allows your expressions to show. So I said, please, let's use it. Let us use it. I want us to try it. And so we used those. We tried it out. And we also gave feedback. We gave feedback. We also gave feedback about how it felt and what we think. And frankly speaking, we think that they can be useful. But it shifted just a little bit, but it was very breathable. Don't allow the plastic part to get over your nose, though. We think it can be useful. Yeah.
And is there any other things that we would be using that would help to, yes, you're talking about the masks, but are there any other things that we're supposed to be doing that would help or hinder communication?
I am happy that you asked, because the one most important thing that we must remember is that deaf people want the information, want people to communicate with them. And how can you do that? You need to learn to sign. More and more, we keep telling people the most important thing you can do if you care and you want to communicate, learn to sign. Right now on www.cflctt.org, we are inviting persons to come and register and book your class, right? A lot of people actually came and they registered, but they didn't understand that the next step was to book. And we're asking those people to please come back and make sure that you get your class, which days, and so on. Right now, we have 2 classes of persons who are new, totally new, and want to learn to sign. And then we have
continue this, and we consider the conversation about the classes when we return from this break. We're speaking with Mrs. Nicole Paul, Executive Officer of the Caribbean Sign Language Center. Stay with us. Welcome back. We're speaking with Mrs. Nicole Paul of the Caribbean Sign Language Center. And we just started speaking about online classes. Mrs. Paul, you said that there are 2 classes of new students. Is this happening online or virtually?
Yes, for the very first time, this is happening totally online, right? We invite anyone. Right now, registration continues. Anyone, you have a laptop, you want to learn to communicate, come on down, www.cflctt.org, and you can book your class. Now, what is happening is that we have 2 classes so far of persons who are totally new. We have 1 class of persons who know a little some sign language, And then we have persons who want to move up to level 2, right? We are asking more and more people to come and learn and continue, move up to level 2, because more and more, DK, as you have noticed, sign language interpreting is needed. Sign language interpreters are needed as people understand more and more the importance. Just last week, the Minister of Education, we have a new Minister of Education, congratulations. She actually sent her people to call and ask about having presentations. When she does her presentations, that there must be a sign language interpreter present. So we wrote the proposal and we sent it along. And we're hoping that more and more this trend will continue as Trinidad and Tobago grows more inclusive. Yeah?
No,
We
you speak.
have the news in sign language. We work at the press conferences so that people could get the information that they need at the updates given by the Ministry of Health. And we want that trend to continue so that more and more that people will be totally involved. And we intend to teach the staff at TTT to sign too, like DK.
No, you speak about education, you speak about teaching. School has started back or is starting. In that rollout, do you see any gaps or challenges, or how is that happening with regard to the hearing impaired and the deaf community?
Right. So the deaf community has the schools for the deaf just like regular schools. And the same challenges with incorporating this new normal, this new way of teaching online, it's now happening also with the deaf community. So you find that even more, we need to have the tablets, we must have the devices so that all the students are able, one, to communicate. Now, after you have the devices, you must also have the Wi-Fi, you must have the data, and like any other community, there are the challenges that some people just cannot afford, really. They really cannot just go out and buy these things. So we have been asking people, if you can, help a child, just like the Minister of Education said generally, just like in Tobago, Trinidad, all over, we're asking if you can support us, make available tablets, make available laptops, and we'll be sure to, help the deaf community and the students learn more. But DK, there's one point I wanted to raise, and I'm happy you did. Now, the ministry has ensured that on television and online, there's lots of material, lots of things to learn. But the sign language, it's not there yet. We need to hurry up and add that element. And I know that our deaf students will be the better for it. When there's a group, sit down, work through that, and make sure that deaf students are able to get that kind of support. I know the teachers are working. I know the ministry is working. We're just saying, deaf students need to see it, same like the hearing students.
Well, I think that's sometimes the thing with fluid situations. You're working on something and then you realize, oh shucks, I should have done this. But I guess it's also, it will speak to the effort or the energy that people put behind it, how quickly that is done. But
yeah, it will be done.
Outside of specific classes for the community, do you have an idea of the numbers of individuals who are deaf or hearing impaired in traditional schooling?
The idea of the numbers in traditional schooling. Okay, when you say traditional schooling, because we know for sure there are the schools for the deaf, right? Where the population, the numbers of children are right now quite low. Because remember, we had a spike. A great number of children were at the school years ago, let's say in the 1980s, even into the 1990s, because there had been a rubella outbreak, a spike. So more babies were born and were born deaf. However, as our medical science has improved, you find that less numbers of children are being born who are deaf. So now the population in school is small. But people must understand from the onset that teaching deaf children or deaf education in general is labor intensive. It requires a lot of focus. You know, there's a saying that if you find one starfish and you throw it back in the ocean, it matters to that starfish. Well, it's the same thing with deaf students. If you are able to give those students what they need and focus on them, even though the population is small, it would make an enormous difference to the student. And there are things that are needed still, but that conversation continues.
Working with the technology, are there any technologies that you're seeing it works better to help with deaf and hearing impaired individuals than others? And if so, why?
Okay, fine. Now, many deaf people have been clamoring and asking for a very long time for the institution of a certain type of school that would help deaf children learn. And believe it or not, you know what that is, DK? We're talking about starting with very little babies. If we can do that, it would make a whole lot of difference. Because right now, we don't have universally in Trinidad and Tobago the technology that we're able to screen and find out, pick up as it may, if a baby is really deaf or not. And the important thing about the education of deaf children is this: you must try your very best to begin from young. Because whereas your hearing child, you lean over the crib and you say, "Oh, mama loves you. Mama, you are so sweet. You're a wonderful baby." That baby hears this information and gives you back something as soon as it can. Goo goo gaga, dada, whatever. But what happens is that the deaf infant who is not getting all that stimulus is left wondering, you are moving your lips, but for what? So we need to copy our more developed neighbors in that regard. You know, sometimes you say it's not good to copy everything. We agree. We have here in Trinidad and Tobago our experts, our people who know about the education of deaf children. And the fact is that if we really want to, we can have a deaf preschool. We can have intervention where we work with deaf babies and ensure that the language development that will prevent gaps and problems in the future because of language deficits can in fact be prevented. And frankly, DK, you're talking to my dream as a deaf educator as well, because we're talking about really doing something to stop the problem. If we can go from the very beginning and put in what is needed, you would need to have the equipment, because that's what we're talking about, the equipment to do that kind of screening. Right now, we do have a VR machine that can test a child at 3 months. But just like the problem with the COVID-19 testing kits, do we have enough? I don't think so. I know for sure there's one. But we need to do that kind of thing, nationwide testing. And after that, you need to fit your child according to their hearing aid needs. Some children, it's not one thing fits all. And now we have digital hearing aids that are really small. So children no longer need to feel self-conscious and a little shame that, you know, hey, I'm wearing something that's different. Everybody can see I'm different. No.
And I actually went to Gentry to get a hearing piece molded for my ear specifically, and it was a very smooth process. But definitely this is a conversation that we would like to continue with you. Thank you for making yourself available. Mrs. Nicole Paul, Executive Officer of the Caribbean Sign Language Center. And we want to thank you for joining us on behalf of the entire team. We say, I'm DK Roster, and we thank you once more, and we say have a good night.